record. I'm excited to share this pre-recorded interview with several allied health clinicians. Allow me to introduce Shari Furman, speech-language pathologist with Swallow Studies by Shari and Dynamic Swallow and Speech Therapeutics, Sarah Zira, occupational therapist with Moxie OT, Carrie McBreen, speech-language pathologist with Lake City Speech and Voice Therapy, Jen Anderson, physical therapist with Aspire Physical Therapy, LLC, Carrie Stanley, occupational therapist with Vitalize Home Therapy, PLLC, and Becky Freeman, board-certified music therapist with Greater Chicago Music Therapy. Thank you so much to everyone for participating in this interview. I'd love to hear what settings you work in, especially those that pertain to older adults, and a bit about why seniors might choose to receive care in those settings.
As an occupational therapist, I've worked primarily in folks' homes, so spending a lot of years working in home health, and then more recently working in mobile outpatient therapy in individuals' homes.
And as a physical therapist, I've worked in outpatient home health and doing outpatient services in the patient's home.
As a speech pathologist, I've worked in hospitals, rehabilitation centers, outpatient, and the home setting as well.
As a music therapist, I've worked in a lot of those settings, as well as assisted living, independent living, adult day programs, and hospice.
And as a speech pathologist, I also recently started a private telepractice. So for those patients who have difficulty accessing services to get out into the community, there is the option for telepractice as well.
And as an OT, I've worked in a skilled nursing facility, working with folks that may have had an illness or an injury and they needed to rehabilitate before returning home. Outpatient day rehab, where they might have needed a more intensive level of care. And now I'm currently working with folks in their home in the mobile outpatient setting.
That's great to hear about all of these settings, such a variety for seniors of where they can actually receive services. Acknowledging that everyone's disciplines focus on different things, but what are typical goals that you work on with older adults? What are they actually doing with you in their work with allied health clinicians?
In speech therapy, we are working on communication quite frequently. So speaking clearly and intelligibly, working on expressing yourself. It could be with word finding, it could be with problem solving, memory, the cognitive aspect of communication, and then swallowing, being able to eat and drink safely and being on the safest diet, and being able to enjoy what you're eating and drinking.
In occupational therapy, our goals are really about what you need to do or want to do in a day. So in some place like skilled nursing or in the hospital, we might be more focused on, can you get dressed? Can you go to the restroom? Can you take care of yourself? And then in the home setting, we can work on some of those more complex activities that you might need to do, like cook or care for your pets or your family, or navigate your home safely.
In physical therapy, we're working on a lot of functional activities as well. But then a big thing that we focus on is working on balance. For seniors, fall risk is huge for a lot of people, and making sure that their home is safe and decreasing the risk for falls by removing throw rugs, adding in night lights and things like that, as well as working on their balance to prevent falls is huge for seniors.
In music therapy, we can address some of those areas as well and help support gains in those areas, but also we look at social and emotional functioning as well. We might be looking at addressing isolation. We might be looking at addressing coping with a diagnosis throughout the continuum of as things progress.
I really appreciate everyone sharing that. So many varied goals, but they're all very complementary I think, Jen, especially the issue of falls prevention and lowering a senior's fall risk. I mean, that's something that every allied health discipline addresses in one way or another. So it's really nice to hear that. And lastly, what is the benefit of seniors of engaging with your services? Seniors often say, well, I'm doing PT because my doctor told me to. But what's really the buy-in for seniors with allied health?
I think from a communication standpoint for speech pathology, we're really just looking to maximize communication and really try to figure out where there might be some communication breakdowns so that we can try to improve in those areas. And then for swallowing, I think it's very important to think about all the social aspects of eating and how devastating and isolating it can be for someone. So really trying to maximize what they can eat and try to make some modifications so that they can eat and enjoy their swallowing ability.
I think oftentimes, seniors might be a little hesitant to pursue therapy because they get the impression that, again, it's something they have to do, or there's things that might be sort of taken away from them. But in fact, I think most people are kind of enlightened to find out that there are lots of different ways to solve problems, to look at things. What strengths do folks have? How can we play to those strengths? And how can we find a solution that works for them so that they can be proactive and, feel safer in their homes and continue doing all the things they enjoy?
Yeah. I really agree with that, Carrie. I think that's something that all allied health clinicians focus on, is that individualized approach, that personalized addressing of what a senior needs. And it feels really good to know, that seniors have all of these services to access. Well, this wraps up the interview. Thank you so much to Shari, Sarah, Carrie, Jen, Carrie, and Becky for participating. And to our attendees, we hope you enjoyed the interview. We're going to go back to the webinar now.